Meg Tracy introduced us to Aunt Bertha. Have any of you heard about that system of information referral years ago? And we just thought that would be the coolest thing in the world if we could get someone from that organization. It's now called findhelp.org. And here we are. We have Bryan here. And I'm just going to give you a little background. Chris is a senior account executive with over a decade of experience helping clients and team members achieve outstanding results. He's our kind of guy. He has spent the past 5 years working with customer organizations in California to connect those they serve with valuable resources to improve population health and quality of life. Who could be more appropriate to now take us into the concept of how do we make sure that the people we serve and our families and friends have access to the social determinants of health that are available in their own communities. So thank you for agreeing to be here today.
Yes, thank you for inviting me. Oh, I've got that one.
Oh, you've
Yep.
got it. Okay.
Thank you, Mary, and thank you, everyone. Thank you for having me here today. Can you hear me okay? We're good? A little closer? There we go. How's that? Good? Up? All right. I don't want to break this thing. Okay, how's that? Perfect. Yeah, so great to be here. I was looking for Tom, who talked about social determinants of health and kind of teed me up, but I see he's not here, so I'll connect with him tomorrow. So a little bit, that's what we're going to talk about today, social determinants of health. Find help, a quick show of hands. It's okay if you've never heard of it, but who has heard of Aunt Bertha, now Find Help? And I talked to a couple of you, I know you did because we talked about it. Perfect. Well, I'll give overview today. I think my plan today is give a little background for those that aren't familiar with it. Find Help is a free public site, so there's some value be able to get out of it by searching for programs. Those that are community-based organizations can claim their programs, so I'll talk about that. And also for programs that we may not have listed, we'll kind of turn to you for adding or suggesting programs that maybe we're missing that are local. On top of that, I'll talk a little bit about how our customers leverage Find Help and actually license Find Help to specifically address specific needs. So I'll just go ahead and jump in. I would say if you have questions, we'll have time for Q&A, but feel free. I'd like any input. You people are subject matter experts. I'm an expert in Find Help, but I would really look for you to give me some feedback, both on potentially resources that we're missing or ways that it could be configured to specifically address those with disabilities. So with that, I'll go ahead and jump in. So our mission is, and we've been around for about 15 years, as you can see here, is to connect all people in need with programs and services. I'm going to refer to people today as seekers. So we work with across all populations, whether it's patients, health plan members, students, employees, we consider them seekers. So those that are in need of services. So whether it's, searching for on your own or searching on behalf of another, and a lot of us have, family members or friends that we navigate on behalf of, we'll kind of walk through how you can use the platform. A little background. So our network currently, we are nationwide, and I'll focus in obviously on Montana, but a lot of times you may be helping someone that is in a different part of the country. So it is a nationwide network. We currently have over 54 million users of the Find Help platform. From a network perspective, we built out over 610,000 program locations. So those are the nonprofits, governmental agencies. The requirement to be listed on Find Help has to be a free or reduced cost service, because that's the population we're mostly serving. And it has to be a direct service provider. So we're not going to list a call center, anything that would create extra steps to actually connect with the program or service. The 105,000, so those are claimed community-based organizations. So not only do we want to list every program that's out there, but we have a community engagement team that's constantly doing outreach to community-based organizations to encourage them to claim their listing. So to be very clear, everything is free for community-based organizations. We never charge CBOs, and I'll use CBOs, community-based organizations. That actually opens up a free suite of tools, which I'll talk about a little bit here in a moment. Just like to show this a little sobering. So we had around 2020, we had about 5 million users of the Find Help platform. As you can see, the sharp, dramatic increase over the past 4 years. Part of that was due to the pandemic. Part of it's due to more and more customers So we're adding about 1 million net new users every three to 4 weeks within the Find Help platform. A little bit about who our customers are. So it's free for community-based organizations, and we're definitely going to focus on the public site today, which there's no cost to use that to find resources. But from a customer perspective, we do work with over 650 organizations, and they license Find Help. They use it specifically to configure it and curate it for their population or the initiative that they're working on. So I'll talk a little bit. Healthcare has been hyper-focused on social determinants of health for quite some time, reducing healthcare costs. We're seeing more governmental agencies in very unique use cases that I'll talk about a little bit. And then we are seeing universities, community colleges, and then a lot of national nonprofits that leverage this across the country. And then interesting, we are seeing more and more employees, or employers, I should say, groups like Amazon, Target, Walmart that are leveraging this within their EAP program to connect employees to programs and services. So really, it's any organization that has a population that they're working to connect to resources. Just a quick snapshot of our healthcare, our customer network. So we work with FQHCs, health systems. Excuse me, a lot of them are leveraging Find Help. A lot of them have to be accredited now. Joint Commission for Hospital Systems requires screening for social determinants of health, NQCA for FQHCs, and then health plans as well. So in the past, they would screen, but this actually provides a way for them to take the next step, which is connecting their patients or members to programs and services. Specifically within the Medicaid population, these are some of the groups we work with across the state. Most of them are implementing across all of their Medicaid states. What's interesting about this, and I was talking with Katie from Mom's Meals earlier, is that not only are we kind of the future of Find Help is being able to connect to free and reduced cost services, but because we're working with most of the Medicaid plans, we have the value-added benefits that are available to these members. So being able to expand that beyond the free and reduced cost services, what additional benefits are people eligible for? And then the next thing, and I promise we'll get through slides here and we'll get into the demo. So government agencies, we're working with more and more states. And this is even expanding it further. So in Tennessee, we are working with TennCare, which is the state's managed Medicaid agency. So they have the eligibility file for everyone within Medicaid. What we're now talking with is the Tennessee Department of Aging and Disabilities that is looking to implement Find Help across all of the area of on agencies on aging and disabilities. And because we're working with a Medicaid agency, they would have that eligibility file. So it's even going to the next level of being able to understand what additional benefits someone's eligible for. So Montana. Just a snapshot here. So we have about 93,000 users of Find Help, probably mostly across our public site. Transparently, Providence is a new customer, so we're implementing across all their markets, but they're a new customer. We haven't started implementation. So you can see most of the logos we have here on the right side are more of our national customers. So we don't have as deep a presence here in Montana. But what you will see is that when we do get into the demo, we have programs in every county, but that is an area where I think we could probably improve Find Help is understanding what are the hyper-local programs that we're missing and looking to be able to add those programs so they're available to everyone in Montana. You can see the search heat map below. That's where searches are originating across the state, close to 300,000 searches. And we'll actually dive into live reporting. I can show some of that, what people are looking for across the state. There is a snapshot or screenshot that I took here. So this is a breakdown of what people are searching for. These are the way Find Help's configured, and you'll see in the demo, we have high-level categories. What you're seeing on the right is what people are searching underneath. So, it's pretty consistent with what we see across the country. Financial assistance, help pay for housing. I did see that support groups and support networks was a little higher than what we would normally see. And it does, it's pretty consistent, though we do see it vary in Texas. Dental care comes up at the very top because it's not covered by Medicaid. So it does vary a little bit state by state. And then just wanted to show a screenshot here, breakdown of where searches are originating from. So we have the top 10 counties, top 10 cities, and top 10 zip codes here in Montana. Oops, hello, poked my eye out. So a little bit about the network. So it is a large network. Part of what we do is we have a curation team. I'm sure those that are familiar with looking for resources, the information changes all the time. So we put a big effort. The largest team at Find Help is our curation team. So any user of Find Help, we have, anyone within the platform, I'll show in the demo, can let us know about something that needs to be changed. So if you see the hours, we have them as 10 to 5, they open at 9 a.m. All you have to do is enter, opens at 9 a.m. That creates a ticket with our curation team. Someone will reach out to that nonprofit and update it within 48 hours. And that's our service level agreement. Any one of those 105,000 nonprofits that have claimed their listing on Find Help can update their own information. Part of the free suite of tools is having access to the back end of their program card. So a housing program that no longer has capacity could quickly update their information, say waitlisted or no capacity within their program card. Lastly, we ingest about 150 APIs nightly, Google, Bing, Facebook. Any changes that are detected through those APIs, again, all that does create a ticket with the curation team to reach out, verify that, and update it within 48 hours. So big effort there. It's never perfect, but we do make a big effort to make sure that information is accurate and up to date. And that is part of what we provide for all of our customers. Just want to talk a little bit about the CBO tool. So for nonprofits in here, again, everything is free. Just kind of run through this quickly. So you can update your information. You can kind of control how you receive or referrals or are contacted by individuals. And what I mean by that is some nonprofits will simply say, show up at this location. It's a small food pantry. We're open on the weekends. Please show up. Other community-based organizations want to receive referrals directly within the Find Help platform so they can turn on referrals. And additionally, they can configure screeners. So if there's information they want to gather at the point of referral, they can gather that and it will travel with the referral. And what that means is that if someone at Amazon's helping an employee here in Montana, they refer them over to a community-based organization, that can go directly to the community-based organization, or that community-based organization can say, when I receive that referral, I'm going to have the screener pop up and gather whatever information I need to determine eligibility. An example would be, let's say it's a home improvement program. The requirement is that you are the homeowner. And so they don't want to receive a bunch of referrals for people that aren't eligible. So they could quickly ask, are you the homeowner? Yes, great. No. If you're a renter, please have the landlord apply, or here are some other resources that might be valuable. And then importantly, they get reporting. So, it's important for community-based organizations to demonstrate impact. They do have case management software for that, but for the referral component, they do get reporting to be able to see the total number of referrals they've received, how many people they've helped, and, they can download those and put them into grant requests. Lastly, a couple things here. You can update the status by email. I'll talk about that in a little bit. Importantly, the last one, billing, claims, and invoicing. So we are supporting in many parts around the country 1115 waivers. In California, we're supporting CalAIM, where much of the funding is flowing from CMS to the MCOs, who are then reimbursing the community-based organizations for services. And that can all be done, the billing, the claims, and the invoicing within Find Help. So that's kind of like the newest thing as we see those rolled out across the country. Oregon, Washington, New York's doing it now. So happy to talk more about that, but that's kind of like down the road a little bit. And so a couple things, and I'll just walk through it. So claiming, and I'll show this in the demo, you can claim from any instance of Find Help. That allows you to get this little check mark for community-based organizations. And I won't spend too much time on it. Some of the things, these are just screenshots, but for community-based organizations, there's a couple ways that they can respond to referrals. They have an inbound dashboard. That allows all referrals to come into the same dashboard. If they prefer, they can have someone notified via email, and they can simply update the status of that referral through the touchscreen. It does send a status update notification to both the individual who is being helped and the organization that sent that referral. So if Amazon is sending or Providence is sending a referral, when the community-based organization updates that status, it'll let the seeker know, and it'll let Providence Health know. And that's essentially the closing of the loop, which is very important to these organizations. One thing I'll mention here, so for community-based organizations, knowing that This is sometimes a lot of extra work that is not really part of their core mission. We have developed interoperability for community-based organizations. So if they use Salesforce as their system of record, they can receive and respond to referrals directly within their system of record, in this case, Salesforce, which is important. That means they never have to leave their system of record, their case management system. So I will pause there. I think these are just some screenshots, but enough slides. Let's jump. And before I jump into the demo, I did want to mention, Chris, I see is good. We are, 508 WCAG compliant. We do have within our website an ability to provide input. So if there's additional input or thoughts on how we could make it more accessible, we always welcome that information. I just want to put that out there before I jump into the demo, if anybody has any input there. So I'll pause before I switch gears. Any thoughts, comments, questions? Yes.
I was wondering where the funding comes for the findhelp.org.
Yeah, great question. So those are our customers. That's the Providence, that's the Centene, the Molinas. They're all licensed. I'll actually show you some examples. So those are our customers. They're licensing Find Help and they're paying a licensing fee. So what we're doing as an example for Providence is we set up a community site, which I'll show you in a moment, an example, and that's for patients to self-navigate. We want to be able to really support for people to be able to search on their own so that they don't have to, if they're not ready to share who they are, they can still look for that information in a way that gives them the dignity of looking for it anonymously. But then we set up a staff site. So Providence is going to have a staff site integrated into Epic, which is their EHR, and that's where their entire staff, whether it's doctors, nurses, case managers, care coordinators, they are doing work with their patients and making referrals out to community-based organizations and tracking the outcomes of those referrals. So they are the ones that are essentially licensing Find Help. Yep. Any other questions? Yes.
So it's Meg, and I just want to underscore how important your commitment to accessibility is and meeting the standards for accessibility that are laid out in WCAG. It means, right, that people who use screen readers who are blind and low vision can work for Find Help. It means that all of the organizations that you just mentioned who license with you, that employees who are blind and low vision at those organizations can work with you. That is a really important difference, and the University of Montana has made that kind of commitment in its procurement policy. We don't buy software or interact and buy platforms that where we're not building out inclusive employment opportunities. So just really, I thank you for taking a moment to say that. I really appreciate it.
Yeah, appreciate the feedback. Thank you. Perfect. Well, let's switch gears. So is that little tap, what is that doing? Get out of here. All right, so I'm going to walk through the public site first. So, and you can go to this now or afterwards. You can go on your phone. It's device responsive. You can just put in findhelp.org. I'll walk through it a little bit. So a couple things here. I looked up a Missoula zip code to start us off, 59802. So the way Find Help's configured is when you enter a zip code, it's doing 5 searches at once. So that's how you're getting the 1,800 plus programs there. So it's looking at local programs, but it's also looking at what city, county, state, and federal programs you're eligible for. So not as big an issue in large metropolitan cities, but I heard talk about it today. The rural areas, it's often the lack of programs that's the issue. So Find Help will identify that if you're in a specific county, you're eligible for that county program. You're in the state of Montana, you're eligible for the Montana SNAP program, any of the state programs. Finally, and I'll show you some examples, we have a lot of national partners that provide their programs nationally. So they're going to show up in every search within Find Help. So there are programs that may not be close to you, but you still are eligible for just based on the state you live in or being in the United States. So I'll walk through that a little bit. I think the first example, so this is our standard taxonomy. It's called the Open Eligibility Taxonomy. We've developed it, open sourced it. You can see the high level categories. and then underneath the more granular categories. Now, this can be configured and curated for customers. I'll show that when we're done with the public site, but a couple things here. You can always search here by looking for it. You can always do a free text search. So if I just put in food pantry, you can go ahead and click on that. It's still using that zip code, but you can see here a couple things. So this is a program that has been claimed. You can see the little check mark here. So they have turned on referrals. So if someone was using the public site, they want to go ahead and refer themselves over, they can go ahead and do that and make a referral directly to that program. Now, if I scroll down here, you can see these programs here, they're not claimed. So we're not going to make referrals to a program that hasn't claimed their listing and wants agreed to receive those referrals. So it simply lists the next step, which may be to call the phone number or go to the nearest location. You can always look here at more information. So eligibility, a description of services. It will often give the coverage area. So this one is for residents of Missoula. If we scroll down, let me see if I can find another one here. Let's see. Salvation Army. So again, description, and again, it's Missoula. So I'll look at a different area there. A couple things. You can always print the information off. You can always email or text it. So if you're helping someone out, you can go ahead and email or text the program to them. The entire site integrates with Google Languages. With this feature here, though, you can select what language it should be translated into when they receive that. So they don't have to go in and toggle to that language. So if you're working with someone who's Spanish speaking, you can select that when they receive it. And you can go on the site and text yourself some programs and play around with it a little bit and test it out. Couple other things here. As I'd mentioned, anyone can suggest a change. So this is from any instance of Find Help, the public site. If you see anything that's out of, that's not accurate, please feel free to message that. That again will create a ticket with our curation team. They'll update it within 48 hours. We do have filters. So want to highlight these, a few different ways you can filter. There are going to be a lot of programs. If I go into let's go into financial assistance where there's 568 programs. This enables you to narrow the search down. So the first filter here is based on the federal poverty line. If you enter the total number of family members and monthly income, it will identify programs you're eligible for and will sometimes give an estimate of benefits based on that information. These filters here are high level. Maybe you need to make sure that they provide services in Spanish. It is dynamic. So if it's showing up, there's 5 programs that provide services in Spanish. You can also select by, I can only go in the weekends, or maybe I don't have a car and needs to be within a certain amount of distance. These filters here are dynamic as well, and these are based on the situation or the population that you're searching on behalf of. So, you can narrow the search by veterans. We do have disability here, and this is, you can see all disabilities or specifically. You can also go by different, any of these, they can be multiple tags. And this is basically going to look at what our curation team builds out based on public information. So for every program card, we build out these tags. What are the main services they provide and who are they providing services to? And that's what those filters are looking at, is those tags specifically. So a couple other things here. Let me just do a time check. All right. Last session of the day. I don't want to keep you too late. So that's a public site. A couple things here. So I think immediate value is obviously you can search for programs and services. As I mentioned, there's probably going to be some hyper-local programs that we're missing. Anyone can go to the site here and suggest a program. And essentially you just fill in some standard fields here. It'll do a search. So if I put in, say, I had done some searches earlier. So Missoula Housing Authority, you can do a search. It's going to look at the programs that we have. So we have 4 programs currently listed, but if you put a community-based organization or government program and it's not in there, you can go ahead and suggest that. All that does is alert our curation team. And again, they'll build that out on an individual basis. It's a 48-hour SLA. For lists of programs, that obviously takes much longer. The other thing is for community-based organizations, you can claim your program just by clicking on claim. It gives a overview of the free toolkit that you're able to access, and you can just put in your program name there. It is validated through the URL. So if you're emailing, you have to have your URL has to match that of the community-based organization. And then our community engagement team will reach out to the community-based organization to take over that claiming process. So that is a public site. Any questions? I was going to switch gears, just spend a little time talking about some of the configurability and curation.
Hi there.
Hi.
I was just curious if there's like a rationale behind like how things are ranked. How does Find Help kind of go about that
Yeah.
process?
Yeah, great question. So there's an algorithm. So it has to do, I don't know the exact algorithm, but there's different things. There is, eligibility of services, who the individual, what service they're looking for, the relevance of the program, proximity. Claiming does boost it a little. So once you claim your program, because we consider that program interactive within the platform. So there's probably like 8 to 10. I don't know what all of them are, but there's definitely an algorithm that kind of does that. And you can always switch, like within the platform, we have our algorithm, but you can always, I'm just putting in zip code. So you can always toggle if I'm going into housing. I put in LA zip code. You can always, there's these filters. You can also go, so we have this relevance, so where we're looking at all that information. If you just want to see what's closest, you can just click to the closest and it'll show that just based on proximity. Yep.
Could you show us an example of like in Montana?
Mm-hmm.
We put in diabetes prevention program, shows what it would.
Yeah, absolutely. In fact, and I'll show that one. Thank you, Mary, because I just realized I forgot to show a couple of things I wanted to show. So putting back in the Missoula. So one of the things I wanted to show was if you go into money and where can I go into prescription assistance. So one of the things I wanted to highlight, and I'll go to the diabetes. I just had looked at this earlier. So this is an example. Now there may be local organizations that are providing prescription assistance, and we may be missing some of those, but you can see here, there's a lot of programs that provide, this serves the state, this serves nationwide. These are all claim programs. These are organizations. You can see here, there's a diabetic supplies, affordable diabetic. We work with groups like Eli Lilly and different programs. So they are providing, this is an example where maybe there's not a local program that's providing prescription assistance, but you're able to find these providers that are going to help their nationwide programs. So you qualify for them or their state programs. So that's really where in the rural areas, you can see the value of being able to find those types of programs. So let me go in here and Mary, what was it again? Diabetes prevention. Okay. Prevention. Let's see here. Is there more to diabetes? So this is the first one that's coming up here. So again, what you're getting here are state programs, nationwide programs. So I think this is where we would probably, where I can take value from is like, what are the local programs that we're potentially missing there?
Yeah, and this is Meg. One of the things that we talked about when we did an information and referral project where we really focused on 211 is the opportunity when the state is building out networks of diabetes prevention program and lifestyle coaches with community partners to put it in their scope of work to say, we are working with you to build access to this program across the state. Will you please go in and add some detail into your community profile that this is a program that you provide. So just how we can continue to think, how do we make what we do more knowable, right? And we have to come at it from some different angles, but we absolutely found you had to go to, for folks who want to know, the Montana Department of Public Health and Human Services does have a website that's dedicated to promoting where all of our chronic disease prevention and health promotion programs are. And so that complements, Find Help and what you can find there. So we will be sure to share that website out to folks. Like I think we call it our community guide for Montana. So, yep.
I guess I was curious, so we can get information for services by zip code, but there's not one zip code for the whole state of Montana. So I wondered how you got all the Montana, if it's possible to get all the Montana, like all the Montana WIC programs.
Yeah, yeah, absolutely. So if I look at, like, I'll show you an example here. So if we look at SNAP, so if you go down to the more information, so this is going to show up for every zip code in Montana, no matter where you're searching for SNAP benefits, it's going to show up. And the reason it's going to show up there is because, where is it here? Nearest location, where is it? Should say, oops. Well, normally, oh yeah, here we go, coverage area. So this program covers residents of the following states. So that's going to show up in every zip code across the state of Montana because it's a state-based coverage program. Is that helpful? And one other thing, so I was looking, just to kind of spark any feedback. So I was looking at, this morning I was looking at healthcare, let's see, your health, help pay for healthcare. No, we did that one. So I was looking at money and then financial assistance and no, wait, hold on, what am I doing here? Healthcare, bear with me. Can't read my notes either. So health, help pay for healthcare. And then, oh, there it is, disability benefits. So I was looking at this one. So this has programs, and again, these are going to be, it looks like they're mostly nationwide or state programs, but they're providing, different types of assistance, whether it's, legal assistance for disability benefits, Medicare Help Center, different programs here, disability benefits case management. So part of that is looking at these tags that are built out within the programs that is looking at, who do they provide services to? So just wanted to highlight that. Any other questions about the public site?
So this is Meg again. And
Yeah.
one of the things that we learned about 2-in-1 is, it is a way through the curation process. So, right, what ends up in your database is not necessarily a predatory organization or, there's a certain amount of vetting of what organizations become a part of the database. And can you just say a little bit more, because there are so many ways that people with disabilities get victimized in our open market.
Yeah.
Anywhere from people being promoted that they must have a guardian by lawyers who'd like to charge you to set up guardianship. People don't need a guardian always, right?
Yeah.
And so just wanting to hear a little bit more from you and your organization and how you're helping people to deal with buyer beware kind of issues.
Yeah, it's a good question. And I may not be the best person to talk to that, but I mean, a couple of things. So they have to be it has to be a nonprofit governmental agency. It also has to be free or reduced. It can't be a full cost service provider to be listed on Find Help. There is the ability to, let us know. I mean, we're not in the business of policing the community-based organizations, but they have to be a nonprofit governmental agency of that type, free or reduced. I think, if we hear something egregious, we'll definitely remove it, but we don't, unless we do hear something egregious. It's really, up to the individuals and our customers. So probably not the best thing. I could probably look into that and take it as a follow-up to give you a little better information. But, it is a kind of a public site. We don't want to get into the business of what can be listed, what can't, unless it's egregious. And again, has to be a free or reduced. It can't be a full cost service.
Great. That's super helpful. Thanks.
Yep.
Any other? Teresa.
I'm just wondering, once a community-based organization comes onto the website and claims their listing, is there a fee or cost to that
No.
organization?
No, never for community-based organizations, always free. Yeah. So I can quickly, I know we're getting towards the end of the day, but very quickly, I just want to show you some examples of how our customers leverage it, and how it can be curated specifically. So I'm going to start with the basic. This is UCLA Health. We work with them obviously in California. You can see here, this is their website where they find care, doctors, treatment options. Within their site, we've embedded a search widget. So if I'm a patient of UCLA Health, and they can embed this, what this is doing is launching to their white labeled site. So basically, we're taking everything we built out. It's branded with UCLA Health's colors or logos. They have their own private domain or URL. And so anything that happens on this site is reportable to UCLA Health. They're going to see what are their patients searching for, where are they searching for it. You're not being asked to identify yourself. So if I'm a patient, I'm looking for addiction recovery, very importantly, I'm going to stop looking if I think they're going to know who I am. So what UCLA Health will get de-identified data. Someone's looking for addiction recovery in 90049. I can decide how I want to connect to the program. The reason I showed it, they're using our standard taxonomy. A couple quick examples. So this is ARP, and I think there was some talk earlier about social isolation. So we work with them nationally. Few initiatives. This one's to reduce social isolation. So you can see their navigation bars changed. We've configured it specifically to make it more user intuitive. So things like food and housing have been put underneath basic needs. Not as big a need for their seniors, but they wanted things like social activities, support groups. So we've configured that. Additionally, if I click on exercise classes, they wanted all the programs that serve seniors pushed to the top so they don't have to scroll through or filter on their own. We've pre-filtered that, and then they put these little tags on here saying, this would be a good program to combat social isolation. So it's still leveraging the same network of community-based organizations. It's just configured and curated specifically for their needs. The last one I'll show is Find Help Georgia. They do a great job. This is their website. They have a link to organizational tools to suggest a program. They have some languages that are predominant in the state. So they have the ability to launch directly into that language from this landing site. They also have a very cool video here. I won't show the whole thing, but basically this is, oh, it's only on my laptop, so you probably can't hear it, but it walks through how to use the site. Very nice little video there, which is pretty nice. What I want to show here is they're very focused on early childhood. So if I put in a zip code in Georgia, go ahead and launch to their white labeled site. A couple things here, and we partner with a lot of 211s and United Ways that leverage these flyouts. So these community sites are meant for self-navigation, but if you want to connect them to a navigator or case manager, in the case of 211, to one of their operators, this flyout will pop up to connect them. But what I wanted to point out is they're focused on different initiatives: disability and aging, early childhood. And if you click on those, you can see here they partner with the Georgia Department of Early Care and Learning. So that's pushed to the top as kind of a partner program. So won't spend too much time on it, further, but just wanted to highlight. So when we're working with, state agencies, nonprofits, they're all configuring it specifically to the initiative they're focused in on, the population that they're focused in on. And so there's that ability to configure it and curate it. So, yes, question.
Wait.
Yeah.
How does findhelp.org partner or interface with 211?
Yes, great question. So we partner with them. We are technology, and we don't have navigators. We don't have case managers. We're really focused on how we can help our customers best navigate on behalf of their population. So with 211s and United Ways across the country, and they're all independent organizations. So there's about 200 of them across the country. We partner with them in a couple ways. In Inland Empire, Riverside, and San Bernardino County, we have 211 as a partner. We have a data sharing partnership. So we let them know about changes we find out about. They let us know about changes. So we each have the most accurate and up-to-date database. The other thing that we do, and I'll actually show an example, this is Connect IE. And so this is what I was exactly talking about. This is the community site. So they take advantage of our technology because what we do is we open up the ability to make referrals out to community-based organizations. And we often offload some of that workload of keeping the information up to date so they can take advantage of our curation. You can see here, right here, we partner with the 211 United Way. This gives them the ability to connect to someone at the 211. If they need help navigating, they can go ahead and connect to them. So we partner with them across the country. I'll show one more example here. Connect ATX. So this is the United Way for Greater Austin, and you can see here within their, I'm going to go back to their landing page. So this is their website. If I put in a zip code for Austin, it's going to launch to their white labeled site. And you can see here it's been configured specifically for the initiative. So it's really, I think what they're finding is the public facing interface is much more user friendly and intuitive. And so they're taking advantage of that. The only thing you see down here is that it's powered by Find Help. So is that helpful? Yep. All right. Any other questions? I think we're all right. Well, I appreciate the time. Hopefully that was helpful.
This is
Yeah.
wonderful. Big round of applause for Chris. Thank you
Thank
for
you.
being here with us.
Yeah.
I challenge everybody to go in and find your organizations and see if you agree with the information there and let them know if you want changes. At this point, I'm going to turn it over to Damien to wrap up our day.